Anabolic steroids, also known as juice, gym candy, pumpers, and stackers, comes in many different forms. It can be taken orally in a pill form, applied to the skin with a patch, or can be injected by use of a syringe. Steroids is an important topic, as use among high school students more than doubled from 1991 to 2006, according to the Centers for Disease Control and Prevention. National surveys indicate 3% to 3.5% of high school students have used steroids. Anabolic steroids can make the average man strong, but can transform the athlete into a machine. Steroid abusers have been known to take up to 100 times higher the dose than would be prescribed by a doctor. These individuals can achieve body types similar to those of comic book characters. Some of these elite athletes have been able to artificially achieve some of the most treasured milestones. These milestones will forever taint the record books, such as Barry Bonds' home run record. Say what we want about the media, but in case of steroid abuse, they are for the most part helping educate and admonish. On the one hand, they indirectly promote the use of steroids every time a young child sees one of their superstars on TV with their newly formed muscle structure seemingly out of nowhere. But in recent times, with the new focus and hope that we will rid our athletic sports of this disease, the media is now content with helping fix the problem by reporting the damage and destruction it is causing. The negative aspects of steroids are now being polarized. The media is attacking the steroid user and placing them into a dark light. Whether it's historical records being questioned, Olympic medals being revoked, or crowns being taken away, the youth is hopefully taking notice.
You can take steroids by injection or with creams, but in this case Mario used the drug orally. Once it gets into your bloodstream, the blood carries the steroids all the way to the muscle tissue. Then steroids attach themselves to a muscle cell's walls where they are drawn in by receptor sites. And in the cells of the tissue, these receptor sites in the muscle cells deliver the steroids hormones to the nucleus of the cell. And this is where they react with the cell's DNA to do what it is meant for them to do: increase muscle mass and strength.
Steroids have become popular because they may improve endurance, strength, and muscle mass. However, it is very important to understand that they come along with many health risks. Some of the more serious or long-lasting side effects are headache and dizziness, problems sleeping, nausea and vomiting, high blood pressure that will damage the heart or blood vessels over time, premature balding or hair loss, aching joints, skin problems, and a common condition known as gynecomastia, which is large breast development in men. Another issue facing steroid users is dealing with a greater chance of injuring muscles and tendons. Tendons are found at the end of a muscle and allow the muscle to attach to the bone. When your muscle contracts and shortens, it pulls on the tendon, which in turn pulls on the bone to cause movement. When torn completely, muscle action ceases. Finally, steroids are known to reduce the production of HDLs in your system, which increases the risk of developing heart disease, stroke, and some types of cancer. There are also many specific risks for girls associated with anabolic steroid use. For instance, a woman may have increased facial hair growth, may develop more masculine traits such as deepening of the voice and loss of feminine body characteristics such as shrinking of the breasts. Women on anabolic steroids will also experience changes in their menstrual cycle, along with increasing the risk of getting osteoporosis. Steroids can also have serious psychological side effects. Some users become aggressive or combative, developing roid rage, which is extreme, uncontrolled bouts of anger caused by long-term steroid use. Steroid users can spend lots of time and money trying to get the drugs, and once users stop taking steroids, they're at risk of developing irritability, paranoia, and severe depression. This has been known to lead to suicidal thoughts or attempted suicide. Some of the long-term effects of steroids may not show up for many years, but people who use steroids also appear to be at higher risk for using other drugs such as alcohol or cocaine. As a dietitian or nutritionist, you may encounter clients who are either participating or recovering from steroid use. If so, you would treat the client as you would any patient and recommend training the healthy way by eating the right foods, practicing, and strength training without the use of drugs. Also, due to their altered diets and chemical intake, it is important to measure any deficiencies of vitamins and minerals they may be lacking in and also assist in the quitting process. Steroids can be very addictive. Monitor these clients carefully and note the physical as well as the psychological changes from week to week. A lot of people tell themselves they'll only use steroids for a season or a school year. Unfortunately, steroids can be addictive, making it difficult to stop. Steroids have a laundry list of harmful effects attached to them. By educating today's youth, we can help reduce and recover from this dangerous drug.